Here are 5 common PCOS symptoms you need to know. The first one, and very aggravating for a lot of women and young girls, is facial hair growth. And maybe you're seeking out treatments and laser treatments to remove that facial hair in the wrong places. And that's, of course, because of the higher testosterone levels associated with PCOS. Okay, the second symptom is irregular or missed periods, just not getting your period. And this is, again, related to those hormones becoming imbalanced with PCOS. Number 3 is chronic headaches. And hormonal headaches can be once in a while, it could be once in a week, it could be once a day. Again, because of those hormones being dysregulated when you are suffering with PCOS. Okay, the fourth symptom of PCOS is infertility. So again, a lot of women struggle. You can't get pregnant, maybe you can't stay pregnant, and that's because of the dysregulation of the hormones when you're suffering with PCOS. Now also, depending on where the cysts are in the ovaries, this could be problematic in terms of the normal release of the egg, again, exacerbating that infertility. And number 5 on my list is weight gain. And it can be very, very difficult despite your best efforts when you do have PCOS because the hormones are dysregulated, often tying back to your leptin levels, your insulin resistance as well. And despite your best efforts with your diet and your exercise, maybe, and a lot of times it's simply not enough to try to address that weight gain due to the PCOS. But the good news is I have some tips for you that can really help with your PCOS symptoms, and I've got 3 of them. Okay, number 1 is fix that leptin resistance. I've got a lot of content on how to do this, but just a quick tip is to, again, watch those carbohydrates, try to get up with the sunrise, and make sure you're not eating after dark. That's a great way to start to fix that leptin signaling, and making sure that you're getting enough natural sunlight. Being outdoors and spending more time outdoors becomes very important for that leptin signaling. Okay, tip number 2 for PCOS is to eat liver-friendly foods. So the leafy greens, especially the more bitter ones, are amazing for your liver. Things like turmeric with that active component curcumin, also fantastic. Now some people do actually supplement with this, and this can be really helpful for PCOS to get those high curcuminoids in an actual supplement. You just have to be a little bit careful when you're choosing that type of supplement, so make sure that it is and has been tested to be free of lead, so it has had some heavy metal testing done, as well as I don't like ones with black pepper in them because a lot of people are actually irritated in their digestive tract, so I actually prefer a turmeric curcumin supplement that has something like quercetin to help with its proper absorption, in the same mechanism as the black pepper, but without the black pepper. Other liver-friendly foods are your protein, so something like steak, again, high in choline and carnitine, great for your liver, and things like coffee, believe it or not, can actually be helpful for your liver and can be helpful in moderation for PCOS. And tip number 3 is to do a microbiome type of cleanse and a full body detox. You really want to encourage those internal organs to do their job more efficiently in terms of detoxification. And I do like to do a microbiome cleanse, so using certain herbal medicines. I call it CABO. You can check it out here. I love these herbal medicines in combination to really kill off some of those unwanted organisms that can be in the gut microbiome and in the blood and affecting your internal organs. And using that along with a full body detox, really, really important for your PCOS. Another thing, of course, is to build up your melanin in your skin. So that means getting more natural sunlight, building up that melanin in your skin, which is a great way to detoxify your entire body as well. Now, I want you to learn more about PCOS, especially if you're struggling. I want to hear from you, but please check out this other video that I have, 5 unusual causes of PCOS. I'll see you there.